This portion of the course, we're going to be looking at clinical decisions regarding periodontal disease from a radiographic standpoint. I'm Brett Beckman. I'm a veterinary dentist, and this is our first patient. We've all seen him. Small breed dog, middle to upper middle age, that's never really had an adequate cleaning and evaluation in the hospital. Very commonly what we see is profound disease in these small breeds. You can see here there's considerable calculus, there's debris into the tissue and around the tissue. Just profound disease present. And radiographically what we're going to find is significant bone destruction. We can see here the representation of the calculus on the crown, and then profound bone destruction around all these teeth. Now, there's not much of a decision that needs to be made on this patient. The approach is to extract all the teeth that are affected, and in this case it looks like every tooth is profoundly affected. Now the question becomes, when we've got this much mandibular bone destruction, are we going to come back after we've done the extractions, especially in these locations here where the ventral cortex is close to the apical extent of the bone destruction, adjacent to the distal root on this left mandibular first molar, and again here on both roots of the right mandibular first molar. So when we're looking at utilizing bone grafts, we have to take into consideration what we're actually doing and what we're trying to accomplish. Once bone grows back into these defects, which it will, regardless of whether we use a bone graft or not, that bone is going to be considerably strong based upon the use of that bone itself. This is not a weight-bearing bone. It's not a bone that is likely to sustain a significant trauma of any type going forward in this little dog's life. So utilizing a bone graft here would maybe provide an extra millimeter or two as an end result coronally, but as far as the relative stability of this mandible goes, that's not going to be an issue. And if we put a bone graft in here and it takes 6 to 8 weeks for that bone to organize where it's structurally sound, that interim period between now and the time that that bone forms doesn't provide us any significant stability. It's still as if there was a defect there. So when making that consideration with this type of defect in the mandible, I generally do not use a bone graft. Now, take into consideration what we're seeing here. This is the maxillary view of this dog, and you can see the bone loss adjacent to the incisors here. So if I'm going to extract these two teeth due to the periodontal destruction here, this is past 50% of the root length, so this is stage 4 here. This is definitely stage 4 periodontal disease here. Then upon extraction, we're left with a defect that if we don't utilize a bone graft, then we've got the potential, and a very predictable potential, that this bone level will drop 1 to 2 millimeters over the next year and leave these roots with less bone than they would if we could place a bone graft here, which maximizes alveolar bone height upon healing. So in a case where you've got especially short-rooted teeth like these incisors,